Hello, everybody. My name is Ana Cunha. I'm an internist and ICU fellow. I thank you very much for this invitation for Salami and this topic that we're going to talk, telemedicine, internal medicine. I think it's a very interesting topic, so thank you very much for this opportunity. Telemedicine is not something new. Actually, it's been known since 1905 when Eindhoven in the Netherlands transmitted the first EKG by telephone wires. It's the definition of the 1970s means healing at a distance, but really it can mean anything that we do in order to improve the outcome of patients, and that requires some kind of distance between two people and a communication at a distance. It can be computers, internet, cell phones, or as we see here, the transmission of the EKG by telephone. In 2007, WHO defined this telemedicine or telehealth, that is a broader term but means basically the same, that it was the delivery of healthcare service where the distance is a critical factor by all healthcare professionals using information and communication technologies for exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, for continuing education of healthcare providers, all in the interest of advancing the health of individuals and their communities. So we can see here that is not only for the diagnosis, not only for the treatment, but we can also prevent disease by screenings. We can also do research and evaluation. For example, like we are doing with this Congress, we can continue education of healthcare providers, and this is done very widely in the world. Here in Europe, we have EasyChem and EasyCM as ICU institutions providing this education in a constant way by the means of not only personal but also at a distance, so by this telemedicine concept. So we can see that the telemedicine is very broad, and so for the use we don't need something very complicated. A simple video call or an audio call like telephone can help us sometimes make some decisions that we cannot just with the local healthcare practitioners. Also with applications that everybody nowadays has, like WhatsApp, Skype, or Zoom, even a simple email with the discussion of a case can help improve this outcome of our patients. In terms of time, we can divide telemedicine into synchronous, that is this real-time communication. For example, we make a video call to some other healthcare professional, for example, an expert, and we are discussing the patient as we are talking, or asynchronous, where we record the information, we write an email, and we send, and this person is going to see it in a different time. Also, telemonitoring is a type of telemedicine. In this case, what we mean is that we are monitoring our patient, for example, with this connection of EKG and then connected with the internet to a distance. And we can monitorize the patient in the place we are, that is different from where the patient is. Why telemedicine is so talked in nowadays? Well, we know that the COVID-19 was a tragic situation, a pandemic, that since it was infectious, it brought us this problem of the need to see the patient, but at the same time, the need to protect the healthcare practitioners. We saw that in many countries, we had a lack of healthcare providers because of infection. They got infected, they couldn't be in the hospital, so we didn't have these means to treat patients. And by that, we had this need to speed up a little bit the use of telemedicine in order to overcome some problems. As we saw, telemedicine is not new, it's old already, but sometimes we need some kind of incentive, and there is not a bigger incentive than this pandemic that made us really need to use other ways of treating the patients. What we can take from here is that telemedicine was useful. There were many studies done, and this was approached in several congresses, that telemedicine really helped us treating these patients and with good outcomes. So we can keep some things that are good from the pandemic and use it in other situations. For example, in internal medicine, we're going to see in this presentation that there are several ways of using telemedicine with good, better outcomes, and even at smaller costs than doing in person. So the benefits of telemedicine, we can give some of them. It reduces the use of resources because we don't need so many places to put the patients and the physicians. We don't need to spend so much light. We don't need to spend this transportation of people from one place to the other. In terms of COVID, but also for other infections, it reduces the risk of direct transmission of these infectious agents, and this is obvious. And also at the same time, since we are not needing so much protective equipment, not only we save the money from this protective equipment that can be very expensive, but also we're going to lessen the errors related to working in this protective gear. This was a study done in the ICM that showed that by the use of telemedicine, the not need of being all the team inside the room with these personal protective equipment, we could reduce the mistakes done by visual limitations and hearing limitations. Also, we can have this benefit of bringing expert level medicine to countries that are with reduced staff. So by telemedicine, we can put healthcare practitioners that are, for example, general practitioners, discussing the case with experts in some area. It can be any area actually, and it can be also the internists. And by this, we can make better decisions and we can treat more patients. We have also this other side of this need of having more healthcare practitioners. Again, this was very reinforced with COVID-19, that we had many physicians, many healthcare professionals in quarantine, but of course physicians, because most of the times we work with our brain, so we don't have this need that, for example, nurses have to be all the time near the patient. And we know that being infected is not exactly the same as being sick. And some physicians being in quarantine, I mean, they couldn't go to the hospital, but they could still be working. So why not to use telemedicine to put them in contact with the team, put them in contact with the patient? We have here this example of a machine that was developed that really resembles like the physician. So the patient could see the physician could see the patient, they could talk, he could see or do some kind of physical examination, and by this take some conclusions and make decisions about the progress of the patient. Also, as we see here, one physician can cover multiple sites, and by this we also can overcome this lack of physicians in some places. This can be good, for example, for radiology. We see that radiologists, they don't need to be there to do these reports of CT scans, so we can send them the CT scan report and they will be able to provide us the information. Also for ICU, for example, we can have an ICU physician doing the monitoring at home or in some central place for many places. Also, this can be, of course, transposed to internal medicine, having the internist at home and some people transmitting the information, this in terms of ward, in terms of urgency, and as we're going to see, especially in terms of consultation, this the consultation between the patient and the physician can be done by telemedicine. So here are several things that we've been talking about, how we can use telemedicine. And now in terms of application, this is a program that was done in Mexico for breast cancer screening that I would like to share with you because I thought it was very interesting in terms of a country that had some lack of appropriate screening for women because they didn't have access. There was a lack of radiologists. What they could do is to overcome this shortage of radiologists by sending the images to other places, and by this they could screen 1.3 million women in 30-month period. And of course, with this screening earlier some breast cancer and treat it in the appropriate time. In online training for healthcare practitioners, we have these examples, as I told you, about congresses that can be done online, but also courses. And here I have the honor to be part of the team with Dr. Armin Quispe-Cornejo that will also give you, I'm sure, a brilliant speech in the future. And with him, we have developed some articles published in the journal, this Perlas Científicas, and here with Dr. Armin is very enthusiastic with telemedicine, and so he tried to develop a way to provide medical information for general population and also for physicians. So with this is in the newspaper and online, it's a way of, it's an example of telemedicine by teaching general population. Also by televisit, we can see here this example where the runs were done by an iPad, and the iPad was connected to this tripod so it could be mobilized. And by this, the roundings didn't need to be with the entire team entering in the room. So of course, this again in concept of some infectious diseases, for example, COVID, of course, we could decide in the team who needed to go inside the room, who could stay outside. And with this, we didn't need to limit even the number, for example, of residents to learn in the round. So we could keep this level of teaching with these rounds. Also, we could reduce the use of PPE, and by this reduction of costs, and even for compassionate use of this technology for end of life care. We know that unfortunately with COVID, there was a reduction of the family approach or the family contact with their beloved family that was sick in the hospital, and this had very negative outcomes. And with the technology, we could reduce this distance by making them have some contact with visual approach or telephonic approach. Also, as we're told, with scheduled visits, and we're going to see how this reduces the cost and it increases the happiness of the patients. These telemedicine visits can be done in a very safe way. The patient is put in contact with the physician by some kind of application, and by this they can report the symptoms, they can renew the therapy, and this can be done in a very safely way. And this, of course, is one of the applications of internal medicine. We know that we have these scheduled visits, it's transversal to our specialty, and it's a great example of how to use telemedicine. Another, now giving some examples in terms of diseases that we see very frequently in medicine, just to show that really this is very important for internal medicine as it is for the other specialties, of course. But for example, here in diabetes, we know that the retinopathy is sometimes delayed, the diagnosis, and therefore delayed the treatment because there is a lack of ophthalmologists. And these patients that we follow up in our consultation sometimes are in the waiting list for this approach for many time. And with telemedicine, what this study showed, and look, this study was from 2012, showed that we could reduce this barrier for the contact with ophthalmologists, and therefore have the diagnosis made in a more shorter way. With hepatology, the same. This is a study done in the United States, in New Mexico, where they showed that the telemedicine could provide the diagnosis and especially treatment for hepatitis C, putting in connection the general practitioner with the experts of hepatitis C, and with that they had sustained virological responses and eradication in no significant difference with the in person, but by this could provide access in places that they didn't have this expert physicians. In myocardial infarction, the same. This is already widely applied, that we can transfer the EKG for interpretation by experts while the patient is still in transportation for the hospital. And with this, we can reduce the door-to-needle time for these patients with myocardial infarction. For cancer, the same thing. Here, this is a news from my country, from Portugal, showing that with COVID-19, many people didn't have the diagnosis and the follow-up correct of cancer because of this cancellation of consultations and on the reduction of the interaction between physicians and patients. And with telemedicine, we could overcome this. I bring here this is VC. This is an organization that is very dedicated for telemedicine. And as you can see, they are also dedicated for internal medicine. So there are already applications and websites and groups of people that are developing things in order to facilitate our work in developing the telemedicine. So what about the patient opinion? This is also very important because there is this myth or this notion that the patients need to be in contact with the physician to be happy and to feel like they are well treated. But the thing is that if we put it in perspective, the difficulties that some patients have to be in contact with us in terms of transportation, that needing to take time off from work, needing to spend time in a waiting room, we can see that the patients, if we ask the patients, we can see that most of them say that it's even more convenient to have telemedicine. And here in this study, there was a measure really in terms of travel distance, missed days at work and family expenses. And we can see that they didn't miss so much days at work when they were the telemedicine, and they had even a saving of $32 to $150 each patient in terms of going to the consultation. So it's really cheaper. Other thing that it may be, of course, in our minds, because we know that the physical examination is one of the bases of internal medicine, it may be more difficult, of course, it's something that we have to overcome in terms of telemedicine. But this beautiful article that I found in the very nice journal, actually the Telemedicine journal, shows this here, and I underlined here what of the physical examination is accurate enough to be done by telemedicine, what is not so much accurate. And if you see here, very little things are in red, meaning that they shouldn't be done by telemedicine. Of course, there are ways to overcome this problem of physical examination limitations. The first is, for example, to the first consultation to be presential in order to improve diagnosis accuracy. And then, of course, it depends case to case who should be evaluated in person. So this also leads us to personalized medicine. It depends on the reason of consultation, being neurological, psychiatric, with more accuracy, of course, than, for example, respiratory, because we cannot auscultate, unless, of course, there are some devices like a stethoscope that is electronic, but people won't probably have it at home. Then the telemedicine be more for follow-up consultation, for asking the symptoms to the patients, asking what is the medication, to renew the medication. Also for chronic stable diseases, the same, and to assess the symptoms of patients. And of course, if we have this permanent contact with general practitioners and other healthcare practitioners that can access the patient, sometimes we can overcome this limitation of the distance. So if they have someone close to them that can help us with the physical examination, this would be a plus. Another difficulty is older adults. We deal a lot with older adults in internal medicine, and we know that they have hearing loss and some other perceptual skills, including technological skills. And this also can be overcome by encouraging the patient to use headphones. They will listen better if the headphones are set. And prioritize, of course, video-based encounters, because they will also understand better if we speak with, if they read our lips. They will be in a quiet area. We need to speak slowly, and sometimes repeating is not the best option. So if they don't understand what we say, we can consider rephrasing it so they would understand better. The lack of internet is also something that is pointed out as a difficulty. It's true that in fully rural countries, it could be a difficulty, of course, overcome by some help of the local administration, but it was also found that only in fully rural counties this happens. So even in places that have so much good internet is not a problem for telemedicine. And technical difficulties, that is something also sometimes pointed out as a problem. There is clear data that shows that only in 0.2% of the visits they are dropped due to technical difficulties. So this is something also that should not be considered as a problem. So, and to finish, because my time is also at the end, my take-home messages are this: telemedicine reduces costs, increases productivity, and improves clinical outcomes. We can have some difficulties, but difficulties is not the same as impossibilities. So we should look for solutions. And also never forget that we humans adapt quickly. So this was my speech. I thank you very much for your attention, and I hope you liked it. And I hope in the future you can start using a little bit of telemedicine little by little. Thank you very much.